Good morning everyone. Today I am Khairun Najeeha will be presenting on the female reproductive system, focusing on its anatomy, physiology, biochemistry, pathology and the medical technology used in infertility management. The female reproductive system is a complex network of organs that are responsible for reproduction, hormonal regulations, and also menstrual cycle. Understanding its structure and function is essential for maintaining women's health and managing reproductive disorders. Starting with the anatomy, the female reproductive system consists of both internal and external organs that work together to produce female gametes, support the fertilizations, and maintain the pregnancy. The main internal organs include the ovaries, fallopian tubes, uterus, cervix, and vagina. The ovaries are responsible for producing ova or eggs and secreting important hormones such as estrogen and progesterone. The fallopian tube transport the eggs from the ovary to the uterus and are the usual site of fertilization. The uterus is a muscular organ where implantations and the fetal development occur. Meanwhile, the cervix connects the uterus to the vagina, while the vagina serves as the birth canal and receives sperms during intercourse. Now, let's moving on to the physiology. First, we have oogenesis, which is a process of formation and maturation of the female gametes, known as ova, which occurs in the ovaries. This process begins before birth, pauses during childhood, and resumes at puberty. It will continue until menopause happens. In each menstrual cycle, typically one mature egg is released. If the released egg meets a sperm cell, fertilizations will occur. However, if not, the eggs will be degenerate. Then we have ovarian cycles, which prepares the ovary to release an egg and consists of three phases. The first one is follicular phase. During this phase, follicle-stimulating hormone FSH stimulates the growth of ovarian follicles. As the follicles grow, they will release estrogen and eventually one dominant follicle will mature. The second one is ovulation, which occurs when a sudden luteinizing hormone LH surge causes the release of the mature eggs from the ovary. The egg then enters the fallopian tube where the fertilizations may occur. This will consider the most fertile period of the menstrual cycle. The last one is luteal phase. After the ovulations, the ruptured follicles becomes the corpus luteum, which secretes progesterone, which prepares the uterus for implantations. If fertilization does not occur, then the hormone levels will fall, leading to menstruations again. And then we have the menstrual cycle, which involves changes in the uterus to prepare for pregnancy and consists of also three phases. First one is menstrual phase, which involves the shedding of the endometrial lining, resulting in the menstrual bleeding. Then we have proliferative phase. Under the influence of the estrogens, the endometrium begins to thicken and regenerate after the menstruation. Last one is secretory phase. The progesterone causes the endometrium to become highly vascular and glandular, supporting possible implantations. If the pregnancy does not occur, then the menstruations will begin again. Last but not least, we have the menopause that usually occurs between the ages of 45 and 55 years old. It marks the end of the female reproductive function due to the depletions of the ovarian follicles, when the ovulation stops and then the menstrual cycles permanently cease. Now, let's talk about the biochemistry. First, we have our hormonal regulations. The female reproductive system is regulated by the hormones through the hypothalamic pituitary ovarian axis. The hypothalamus will release GnRH, which stimulates the pituitary gland to release FSH and also LH. The function of it is FSH will stimulate the follicle growth, meanwhile LH will trigger ovulation. For the ovarian hormones, The ovary will produce two major hormones. The first one is estrogen, which promotes follicle development and thickens the endometrium. The second one is progesterone, which prepares the uterus for implantations and maintenance of pregnancy. Then we have a feedback mechanism where the hormone levels are controlled by it. It has negative feedback, which the estrogen and progesterone will inhibit the FSH and LH release, and then the positive feedback, which the high estrogen levels will trigger the LH surge before the ovulations. Then we have a hormonal changes in the menopause. During the menopause, the estrogen and progesterone will be decreased, and then FSH and LH will increase. This we can say that the ovulation stops. These changes affect the reproductive organs, sperm density, and then the overall health. Moving on to the pathology, we have a polycystic ovary syndrome, PCOS, which is a common reproductive disorder that affects the woman of reproductive age. It is characterized by the excess androgens, which is a male hormone productions, ovulation problems, and then the polycystic ovaries appear on the ultrasounds. This caused by the hormonal imbalance or hyperandrogenism, insulin resistance, and genetic and environmental factors. The symptoms that we commonly see is irregular or absence of menstrual cycles, excess body or facial hair, or we can say hirsutism, also acne and infertility. The diagnosis, we use the Rotterdam criteria, and diagnosis will be required any two of the following to be said that the person will have a polycystic ovary syndrome. First one is irregular or absent ovulations. Second one is signs of high androgen levels. The third one is polycystic ovaries appear on the ultrasound. The management will include a lifestyle changes such as diet and exercise, then hormonal therapy, anti-androgen medications, insulin sensitizing drugs, and also ovulation induction for fertility. Reaching to the last part, which is medical technology. I choose laparoscopy in female infertility. Laparoscopy actually is a minimally invasive surgical technique that used to examine and treat female reproductive organs. The procedure is like do a small incisions in the abdomen, and then a laparoscope or camera is inserted and carbon dioxide gas will infect the abdomen to improve the visibility. This laparoscopy is applicable to diagnose and treat the endometriosis, blocked fallopian tubes, ovarian cysts, pelvic adhesions, uterine abnormalities. And then its advantages will include that the small incisions that make the scar less and less pain, and then it will be more faster in recovery, accurate diagnosis and treatment, and then also improve the chance of fertility. However, there is limitations, which is firstly it requires specialized training and equipment, and then it have a risk of complications and side effects. The third one is it is expensive, especially for the robotic procedures. And the last one is the outcomes will depend on the surgeon's skills and the patient's anatomy itself. To summarize, the female reproductive system is complex and carefully regulated by the hormones. Disorders such as the PCOS can affect fertility. However, with advance in the medical technology like the laparoscopy, we can improve the diagnosis and the treatment. This will make the understanding of this aspect in the promoting the woman's reproductive health and also fertility. That's all from me. Thank you for watching.